Hello, this is a presentation on the Triple Aim. It is a 4-hour development seminar. I'm your facilitator, doctoral student Alicia Albritton. This 4-hour Triple Aim development seminar will take place on March 25th from 1 to 5 p.m. at Phoenix Department of Veteran Affairs. The workshop format includes interprofessional meet and greet, Triple Aim project development, lunch, project presentation with immediate faculty feedback. The Triple Aim of Healthcare. What exactly is Triple Aim? In 2007, 3 doctors, Dr. Burrick, Tom Nolan, and Dr. John Whittington, working at the Institute for Healthcare Improvement, began recruiting organizations from around the world to participate in a collaborative to implement what became known as the Triple Aim. There's a total of 141 participants with various healthcare organizations, including hospitals, healthcare insurance companies, and other facilities. In 2008, researchers at the Institute for Healthcare Improvement proposed Triple Aim: strategic organizing principles for healthcare organizations and geographic communities that seek simultaneously to improve the experience of individuals with their health care and the health of populations to reduce the per capita cost of care for populations. In 2010, the Triple Aim became part of the U.S. National Strategy for Tackling Healthcare Issues in conjunction with the Patient Protection and Affordable Care Act of 2010. The Triple Aim includes all healthcare professionals who have a role in patient care. These are workers such as community health care workers, peers, medical assistants, nurse aides, psychiatrists, physicians, nurse practitioners, social workers, psychologists, addiction counselors, case managers, and representatives from community agencies. All of these people comprise the integrated care team. There are 3 dimensions of Triple Aim. These include improving the health of populations, improving the individual experience of care, reducing the per capita cost of care. Healthcare organizations, public departments, social service entities, school systems, and employers are now mandated to implement the initiative. Here is a model of the Triple Aim. So, improving population health. Faculty supervisors will provide data from previous hospital performance assessments. Healthcare workers will schedule unconscious bias trainings at a minimum every 6 months. By using the Triple Aim, administrators will work with healthcare workers to create the right foundation for population management, manage services at scale for the population, and establish a learning system to drive and sustain work over time. What is patient-centered care? Patient-centered care refers to care that is respectful of and responsive to the individual patient needs and values, in which patient values guide all clinical decisions. Here you see a model of the evolution of the focus of healthcare delivery. This includes disease symptoms that have been dominant, person, family-centered, population health-oriented. Pardon me. So looking at the diagram, you see the evolution of care delivery. According to Shi and Singh in 2018, in a patient-centered care model, providers manage and coordinate care and are accountable for disease prevention and wellness. Accountable systems of care serve as organized, vertically integrated networks that employ and contract with physician offices or community health centers. Here's a model of population health. As we learn about the triple aim, we recognize there are multiple factors besides healthcare that impact the individual's overall health. According to one study, 50% of what determines health is related to socioeconomic and environmental factors. They can also be called upstream factors. Upstream factors include income and wealth, education, employment and occupation, family and social support, the food environment, community and safety, media, information, environment, environmental. Upstream factors also include individual factors, such as behavioral factors, spirituality, resilience, physiological factors, and genetic endowment. How can a healthcare worker at the VA improve how healthcare is delivered in practice? This brings us to improving the experience of care. The Institute of Medicine breaks down the 6 aims for healthcare quality improvement. This is also known as STEEP. STEEP stands for safe, timely, effective, efficient, equitable, and patient-centered. Triple aim project development, small group discussions. Building trust for multiple minority communities. Identifying the problems and goals. Addressing racial and ethnic disparities. Integrating behavioral health initiatives. So, improving the cost of care. A study found in April, the government of Ontario, Canada announced a multi-year phase-in implementation of patient bias hospital funding. These hospital funding reforms reduce reliance on global hospital budgets, such as fixed annual amount based largely on historical spending. By reducing 2 new components to hospital funding, health-based allocation model, organizational levels funding based on service and patient characteristics, and quality-based procedures. The goal here is to facilitate adoption of best clinical practices, evidence-informed practices, and appropriately reduce variation in cost and practice across the province while improving outcomes. Board members will discuss the financial budget the next fiscal year. The triple aim goal here is to address reduced capital per cost for health care.